आवाज आ रहा है मेरा?
आवाज आ रही है। मैंने स्टार्ट कर दिया मैंने।
Good evening to all. Good evening to all my delegates who are gathering here as a digitally gathering here. So thank you very much behalf of whole Kerala Pharmaceutical Company. And I would like to introduce our beloved speaker, Dr. R.K. Verma sir, who is well known, and he is the renowned doctor of whole Magad division, and his nursing home is running here since 60-year-old. He is a very renowned doctor, surgeon, and his full name is Ratneswar Kumar Verma. So now I would like to welcome to our R.K. Verma sir. I would like to give such light to our today webinar. Our webinar is all know the topic is Travis. You all know 1.5 crores animal bite cases are available in every year. Now in the present scenario, we have only 5 doses, and it is the very old category cell culture vaccine we have present in the market. But now we have launched 3 doses. So now we have in hand over to all the session to our respected Verma sir. Verma sir, now session is yours. Start, sir.
Thank you, Amit. Today good evening, everyone. Today I'm going to talk about rabies dosage reduction strategy. We are having some technical issues. Please bear with us. Good evening. Today we are going to talk about rabies, the new rabies vaccine, dosage reduction strategy in rabies management, role of the novel vaccine. As we all know, rabies disease is a zoonotic disease caused by rabies virus, RABV. Virus is encoded by 5 structural proteins, and G protein is the major antigen in the formation of neutralizing antibodies NAB against the rabies virus. Epidemiology. Globally, rabies accounts for 59,000 deaths per year. In India, it causes 20,000 deaths, 91% of which happens in rural areas. Rabies is 100% fatal, but 100% vaccine preventable disease. Evolution of rabies vaccine. The first rabies vaccine came in 1885, which was a live attenuated vaccine derived from spinal cord. It was a non-standardized dried preparation, and 31 injections of increasing immunogenicity was required. In 1911, an inactivated vaccine having brain up to 10%, which was minimal neural content liquid preparation, which required 14 injections of 0.5 ml daily. Then in 1976, we had a cell culture inactivated vaccine, which had a standardized immunogenicity lyophilized, which required 5 injections of 0, 3, 7, 14, and 28 days. Current challenges in vaccination. Current rabies vaccines are cell cultured vaccines. Inactivated vaccines are more than 50 years old technology. Decreased compliance, patient compliance beyond 3 injections. Inconsistency in potency, stability, short supply, and adverse events. These are the current challenges. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. Introducing Thrabis. It is the first protein subunit vaccine prepared by VLF platform technology. It is the first vaccine with 3-dose intramuscular regimen of 0-3-7 days. It has better patient compliance due to easy to follow regimen and less visits. Convenient to use, no reconstitution needed. VLP technology. As you all know, G protein is difficult to stabilize. G protein isolation using VLP technology purified and stabilized by Cadila Pharmaceuticals Limited. VLP, that is virus-like particles, are protein complexes which exist as nanoparticles. VLPs are similar to native virus particles, but that do not contain the viral genome. Cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of introducing a strong humoral and cellular immune response. These are in these slides, you can see the original research articles. Our novel recombinant rabies G protein vaccine, Thrabis, a VLP-based rabies vaccine. These are the data for the clinical phase 2 trials and clinical phase 3 trials. The safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization. A randomized comparator controlled multi-center phase 3 clinical study. Objectives of the phase 3 study were to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. The regimen was 0-3-7 days regimen, and 533 subjects were involved, of which 267 subjects received the original 5 regimen Divipur reference. A randomized comparative control multicentric study of involving total 800 subjects were done with a randomization of 2:1. Study and design objective: to demonstrate non-inferiority of the test vaccine to the comparator vaccine. Primary objective was subjects with seroprotection at 14 days post first dose. Seroprotection RVNA titer more than 0.5 international unit per ml. Secondary objective was subjects with seroprotection at day 42 post first dose of test vaccine. Safety by monitoring subjects with adverse events. And seroprotection, the protection obtained by vaccination. This is a chart shows the results. The results were consistent across different age groups and genders. Observed difference of 1.52% with the pre-specified margin of -4%. Non-inferiority for seroprotection. Primary endpoint day 14 and 42 were met. Test and comparator identical in seroprotection rate, both on days 14 and 42. The Thrabis has better safety profile compared to reference vaccine. study conclusion. Rabies was non-inferior to reference vaccine, less adverse effects compared to reference vaccine. Novel 3-dose rabies was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. And these are the awards for the innovation of rabies vaccine to Cadila Pharmaceuticals, Pharma Innovation of the Year Award, the Golden Globe Tigers Award. Thank you.
Thank you very much, sir, for your beautiful speech you have given here. And I would like to ask our all delegates participants if any query you have, so you can put on your chat so that Dr. our R.K. Verma sir can reply your answer. So waiting for your question. If you have any question regarding the rabies, anti-rabies, and our rabies. Sir, one question is coming, sir. The question is, what are the sign and symptom of rabies in humans, sir?
Signs and symptoms of rabies are increased photophobia, hydrophobia, irritability,
Yes, sir.
toxemia. It depends upon the post-exposure. You have to have a history of dog bite, rabbit dog bite. Have to have a history of dog bite or an animal rabbit animal bite. And the most characteristic symptom is a hydrophobia, fear of water, laryngospasm.
One more question is coming, sir. The question is, what are the advantage of 3 doses anti-rabies vaccine?
The major advantage of 3 doses rabies vaccine is patient compliance. It is easy to administer, only 7 days are required. And the patient usually forgoes last 2 doses of the previous vaccine. Here you get total immunoprotection in 3 doses in a week, 0 to 7 days.
Yes, sir. Previously, we have 5 dosage, 0 day, 3 days, 7 days, and 5 days, 28 days. And the problem was that, sir, non-compliance rate was very high, sir. But in our 3 doses, sir, the best convenient for the patient, he can take, sir, 1 week for full dosage he can take within a 1 week, sir. Know, sir.
Yes.
Also, adverse effect is also very less. Our Travis, sir. One question is right, sir. One question in also last question is coming, sir. What type of animal bite cases you come across apart from dog bites?
Animal bites. In which part? We have got in this,
I think
in Bihar,
doctor is right. I think doctor is asking only dog bites is not the causes for rabies fatal. There are so many mammals like dog, cat, monkey.
Dog,
These are all.
cat. Yeah, of course. Monkeys, dogs, rabbits. In fact, also cats. Also monkeys. Yes. Rabies is suspected in many cases. Any animal bite, you can suspect rabies.
If any more questions, our participant can put in the chat. If clear, so I would like to thanks to our respected speaker, sir, Dr. R.K. Verma, sir, and also I would like to thanks our all participant जो आप लोग अपना कीमती समय निकाल के हमारे वेबिनार में आए और आप लोगों ने हमारे वेबिनार को सक्सेस किया। तो मैं आप लोगों से रिक्वेस्ट करूंगा कि जहां भी देखें रैबिज पेशेंट, यूज ओनली 3 डोजेज ऑफ रैबिज वैक्सीन, दैट इज थ्रेविस, 0 डे, 3 डे एंड 7 डे। जहाँ पे आप लोग को 5 डोजेज में 1 मंथ का समय लगेगा, वहाँ पे हमारा जी प्रोटीन थ्रेविस वैक्सीन आपका 1 वीक में वो कंप्लीट कर देगा। तो कन्वीनियंट है पेशेंट के लिए भी, कन्वीनियंट है आपके लिए भी। तो हम आप लोग सारे लोगों से रिक्वेस्ट करेंगे, जितने भी हमारे डेलीगेट्स हैं, हमारे पार्टिसिपेंट हैं और हमारे स्पीकर सर, तो आप हमारा लिखते ही हैं सर थ्रेविस, जितने भी डॉक्टर हैं वो लोग प्लीज प्लीज थ्रेविस को लिखें। हमारा लगभग 1 साल ऊपर क्रॉस कर गया है और अभी तक ऐसा कोई भी वर्ड्स ये आया नहीं है जिससे कि ये हम लोग इसको ना बोले देने के लिए। इवन बच्चों लोग में, छोटे बच्चों में का भी ट्रायल हम लोग का पूरा हो गया है। फर्स्ट टाइम द हिस्ट्री हुआ है कि ये ट्रायल 800 पीपल पे हुआ है, जहां अदर वैक्सीन 250 लोगों पे किया था ट्रायल, हम लोगों ने 800 लोगों पे किया ट्रायल और सक्सेसफुली हुआ है। इसलिए इसका सेरो प्रोडक्शन रेट भी, जहां हम लोग 14 डेज टू 28 डेज में पूरा कर रहे हैं, हम लोग का मात्र 7 डेज में ही उसको कंप्लीट करते, मतलब सेरो प्रोडक्शन रेट भी हम लोग का बराबर है। तो कहीं से भी आप लोगों को कोई ये करने की जरूरत नहीं है। जस्ट ये अवेयर हम लोग करना चाह रहे थे कि अब आप लोग के पास 5 डोजेज की जगह 3 डोजेज आ गया है। तो हमेशा जहां भी रेविज यूज करें और थ्रेविस यूज करें। हम लोग का स्लोगन भी है 1 2 3 रेविज फ्री। So once again, thank you very much, sir, Verma sir, and all my delegates. I hope लगभग 300 people participate हमारे ज्वाइन किए हुए हैं, जो हमें और डॉक्टर साहब को नहीं दिख रहा है, लेकिन हमारे मैनेजमेंट का टीम है, हम लोग को भेज रहा है लगातार। तो थैंक यू सर, आपने इतना बड़ा टीम को इतने अच्छे से हैंडल किया सर, इसके लिए वंस अगेन हार्टिएस्ट थैंक यू सर। थैंक यू सर। तो लास्ट हम लोग इसको क्लोज करते हैं सर। थैंक यू वेरी मच सर।
हेलो हेलो सर, आपका पूरा हो गया? हेलो 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 सर,
हाँ हाँ सर,
आपको आपको मेरी आवाज आ रही है?
आ रही है।
आपका सेशन कंप्लीट हो गया ना?
पहला सेशन कंप्लीट हो गया। आप और कोई आए थे क्या सर?
नहीं, कोई नहीं
आए
आया
होंगे,
था। दो
आए
लोग
होंगे
गए
पता
थे।
नहीं।
2 लोग आए थे पर बाद में वो निकल गए।
अच्छा अच्छा, ठीक है, कोई बात नहीं। ठीक है, थैंक यू सर आपका।
थैंक यू सर।
चलिए।
अब एंड कर दूं ना सर?
हाँ हाँ, बंद कर दीजिए।
थैंक यू सर।